a little low and tight. I'm gonna get you just right, pull you up to outer space. Wasn't that?
Here we go again. Welcome back to my podcast, Suboxone Out the Monster. This is episode number 8. I am your host, Don Horner, or Dr. Don. Remember, the purpose of the podcast is to get you off of opioids and transition to Suboxone. But first, the old medical disclosure. All information provided in this podcast is for informational and educational purposes only and does not constitute medical, nursing, or other professional healthcare advice, diagnosis, or treatment. Always seek the advice of your physician, pharmacist, or other qualified healthcare provider with any questions that you may have regarding medical conditions or treatment. And never, never, never take any drug or medication that is not prescribed by your healthcare provider and filled by your pharmacist. There's a lot of fentanyl out there, and fentanyl will kill you. I just love saying that. So today let's talk about Suboxone for pain. Is it appropriate to treat pain with Suboxone? The answer is a definite maybe. It depends on the circumstances. Suboxone for people with opioid use disorder or addicts can relieve withdrawal symptoms and prevent relapse. Remember, Suboxone contains buprenorphine, which is an opioid, and has pain-relieving benefits like all opioids and blocks the pain receptors in the brain. But Suboxone is not FDA or Food and Drug Administration approved for the treatment of pain because studies for the treatment of pain with Suboxone just have not been done yet. Why not, you ask? Because studies are very expensive and drug companies just don't want to spend the money unless they have to. Maybe one day they will. While Suboxone will help chronic pain patients with opioid use disorder, it is not the best medication for people without opioid use disorder. Chronic pain is defined as pain lasting more than 3 to 6 months. People have used opioids to treat pain for thousands of years. Of course, drug companies have developed a variety of opioid medications to meet the widespread demand for pain management. Of course, opioid use to treat pain can lead to opioid addiction, since opioid receptors in the brain manage pain sensation. Activating these receptors with Suboxone can relieve pain. Compared to other opioids killers, Suboxone has a ceiling effect, making it safer with less risk of overdose. Remember, ceiling effect makes the drugs euphoric effect, that's the high, and respiratory depression, to stop breathing and die with overdose, plateaus or doesn't get any worse at moderate doses of Suboxone, usually 16 to 24 milligrams per day. And 16 to 24 milligrams per day is the typical daily dose of Suboxone. Unlike full opioid agonists like heroin, oxycodone, and fentanyl, Suboxone could involve, number one, easier usage amongst elderly patients and people with kidney disease. Number two, lower tolerance development. That's where you want more and more and more drug for the same effect. Number three, better effectiveness with nerve pain. And number four, lower ceiling effect for respiratory depression so you don't overdose, stop breathing, and die. Again, Suboxone is not FDA approved for pain, but some providers prescribe it, quote, off-label for pain. But this is not the intended use. But why is Suboxone used for pain in people without opioid addiction when Suboxone can be addictive? Good question. So the bottom line is, if you don't use Suboxone for pain alone, but reserve it for people with pain compounded by opioid addiction. But why not use Suboxone for all patients with severe chronic pain when it's less addictive and safer than other opioids? That's a good question, which would require further clinical studies. Now, in the next segment, I will introduce another person who will discuss their journey to Suboxone. As always, just keep it in the road. Thank you. Okay, ladies and gentlemen, here we have our next guest. This is Ashley. Ashley has also been my patient for a long time. She's a very special person, and she has like 20 kids, don't you?
6 total.
6 total. That's like 20. Okay, good. Actually, this podcast is about convincing people to get off of opioids and onto Suboxone.
Okay.
Okay, and all we want to do is to hear your story.
All right.
Okay. Now, how long ago did you first start using opioids?
Let's see. I am 38, so 20 years ago on the dot. I
20,
was 18.
20 years, 18. Now, when you started opioids, was it for medical reasons, surgery, or was it for recreation?
It was medical. It was during the height, the opioid height, I guess you could call it, where all the doctors, that was their way to solve everything.
Right, gotcha. Now, what opioid did you first start on?
They started me on 5 milligram hydros. It went up to 7.5 hydrocodone, and then Percocet. My doctor, who unfortunately has passed away now, he put me on 5 milligrams, 7.5, and then 10 milligrams, trying to get rid of the pain. I used to race dirt bikes, motocross, so
Gotcha.
I damaged my knees and my vertebrae pretty bad.
Okay,
So I was in horrible pain. So when I
gotcha.
went to the doctor, that's what he had done. He put me on opioids.
Gotcha. Yeah, that was the magic cure for everything.
Yes,
And it was handed out like candy.
it was.
Okay, back then. Okay, it was terrible. Bad mistake. Ruined a lot of people's lives.
It did.
Now, after the hydrocodone and Percocet, did you go to any other opioids?
No, I've never done a street drug. See, that's the thing. I was scared to take 2 Tylenol. I was scared of goody powders. I would not take anything that I thought could honestly kill me. But when a doctor at a hospital gave me a 7.5 hydrocodone, I was like, okay, I'm at a hospital. I feel safe. I can take it. And if something happens, I'm okay. Well, the feeling I got from it, it started a whole lot of issues. I was addicted from the very first one.
Wow. So eventually the doctor stopped giving you the pain medication. What did you do then?
Well, you've talked to John, but we had a customer, Georgie. We would get like 150 of his Vicodin for like $100. Like we were going and then buying pills from our customers or whoever may have had them at the time. Because then they were kind of cracking down on, oh, we're not prescribing this. They were doing pill counts. Of course, you're eating them. You're a drug addict. So when they would do the pill count, if you didn't have them, they would stop prescribing them. Well, you didn't want to be sick, so you're buying them from whoever would sell them.
Right, the dealer. Right. Now, John is your boyfriend. Okay. And how long have you been together?
It's 16 years.
16, a long time.
A long time.
Okay. That's wonderful. Well, it's practically, it's like marriage. Okay.
Yeah, we're practically married.
You got it. That's wonderful. Now the kids, how many are yours and how many are John's and how many are the combination?
I got married at 18, so I had 3 coming into the relationship. John had 1, and then we have 2 together.
Wow.
So that's
Blended
where we
family.
get 6.
Wonderful. Congratulations.
Thank you.
Now, were you and John both using opioids at the same time?
Yes. Yeah, we worked together. He was my boss. He was my manager. I was his sales manager.
Okay.
So we actually didn't know each of us were prescribed all these pain pills. And then the more we became like friends, the more we realized we both had an issue.
Right. Gotcha. Right. And so you both dealt with the same dealer.
Yes. So then we worked together to get our addiction.
So you did. You worked together. Well, great. Mutual support.
Yes.
Okay?
Well,
That's a wonderful way to do it.
not many codependent people make it this long. We're kind of like a rare couple.
Oh, you love each other to death, and you're going to
Absolutely.
be together forever. Okay, so that's wonderful. That's wonderful. Now, so you never used any injectables? Is that
I
correct?
haven't. John has tried everything under the sun. I will not put anything, no offense, I'm not judging, up my nose. I'm scared of needles. I was just very, picky on what I took.
Gotcha. Great. So some time went by, and then eventually you got off of your opioids and onto buprenorphine,
Yes,
Suboxone.
we lost our
Now, what?
job. We were
You
unable
lost your
to
jobs.
afford our habit. John went and got on Suboxone. I wanted to kind of quit cold turkey, but I couldn't because I had to work. I had kids. I had to support my kids. So
Right.
then he found the Suboxone program, and then we both went to Dr. Fee, and then I went and got on Suboxone, and I was able to work
Wonderful.
and not need pain pills. So it was a lifesaver in a way.
Now, your transition from opioids to Suboxone, was it difficult?
It was at first. I think my habit was being able to swallow the pill and waiting for your nose to itch. I know a lot of people say that, but you wait for that nose to itch. That was a transition, but once you're putting on the right dose of the Suboxone, it does replace the opioids. So it's not
Right.
a huge transition. It's just a little different.
Got it. Now, are you using Suboxone pills or films right
Film. Well, I go back and forth. You're my doctor, so you would know. If
now?
something's up with my insurance, I go to the pills. I break them in half and do it under my tongue, one on each side. Or the film, I rip it in half and do one under each side of my tongue. Same thing.
Right. And it tastes like crap, I
They
heard.
are not good. I used to put it like a Starburst on my tongue or a piece of gum, and while it dissolved, I would like
Yeah.
mask it with a
Good
piece of
for you.
candy.
Well, that's very creative. Okay.
Yes,
I think that's great. That's great. So there was just a mutual thing. You both wanted to get off of opioids. Is that correct?
absolutely. Yes.
Okay. Great. Now, did you ever do anything illegal?
Oh
Like
God, yes. You
stealing drugs or?
no, no. Now my problem, because I was like part of this whole doctor overprescribing system, I wasn't
Mhm.
just on pain pills. I was also on somas, and they gave me 120 Xanax
Mhm.
the moment I walked into their office. Like, here you go, 120, have at it. So I was on like what
Wow.
they call the Trinity, trying to get that, and you're in a totally different mindset. I was breaking into cars. I got 18 felonies in one night. Um,
Oh,
Thank
wow.
goodness all of that was cleared up. It was expunged off my record. I
Great.
just stick to the Suboxone now. I don't do any of the other medications. I just do the Suboxone, and it has helped.
Did you ever get busted?
Oh yeah. I got arrested. I spent 38 days in county.
Oh, I lost you. Ashley? Ashley? Oh, no. Ashley?
I'm sorry. We're back. I'm
Oh, I lost you for a
sorry.
second, okay?
I did. I got arrested. I spent 38 days in county. I completely got off of everything because I realized I was going to go to prison if I didn't. So now I only am on Suboxone.
Good. Now, any withdrawal symptoms now?
Say that again.
Any withdrawal symptoms now?
I mean,
Withdrawal.
you wake up and there's a little here and there, but no, nothing like, because it's always kind of there. No, I don't have any like. You do when it's time for your dose. I can't completely say I don't. You have like a withdrawal, like sweaty. You break out in a sweat. Your nose is running. You have that, but it's time for like your next dose. It lasts so much longer than the pills. Like you need a pill every 4 to 6 hours, if not sooner.
Right.
But the Suboxone, it does last its time frame.
Yeah, the half-life of Suboxone is about a day and a half.
Okay.
Okay, and people sometimes only take their medication every other day because of that. So it's a much superior product, much smoother, much
Yes.
longer acting. Okay, people function. You take care of your children. You work.
Yes.
You sleep. You eat. Okay, you don't break into cars.
No, you don't go to prison. You don't do dumb
You know,
things. Exactly.
that is wonderful. That is wonderful. Now, if you had to say one thing to people on opioids thinking about going on to Suboxone, what would you tell
Honestly, if you have children or family that loves you, which everybody does, the opioids are killing you. They really are. I mean, there's chemicals you want to get out of that type of pharmaceutical industry. the Suboxone is nowhere near as damaging to your body.
Well, actually, you're very brave. You're a hero.
Thank you.
Okay, you know that. You ought to be very proud. And I want to thank you so very much. And if we will convert one person from opioids to Suboxone,
Yes.
then we will have done our job.
Yes, and it's a lot
Actually,
cheaper.
It is. This is God's work.
Yes, sir. Absolutely.
It's God's work. Actually, I'm going to hang up now, but don't hang up, okay? I'm going to talk to you in a second, okay?
All right. Thank you.
Thank you.
Ain't that a beautiful sight? Coming in quick, a little low and tight. Gonna get you just right, pull you up to outer space. Wasn't